Today we're going to talk a little bit about other health impairments. This, of all of IDEA's different classifications for disabilities, is the most broad, and it's important that they have it because there are a lot of things that don't necessarily fit in any of the other classifications, but it still hinders some of the students' ability to succeed in school. So, what does other health impairments mean? According to IDEA, other health impairment means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment. And that, one, it's due to chronic or acute health problems such as asthma, attention deficit disorder, or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and Tourette's syndrome. And two, adversely affects a child's educational performance. So these are the two main things. It's interesting that they clarify that it's not just impaired alertness, but also a heightened alertness, but to environmental stimuli. That's clearly for things like ADHD and ADD. So there are a few common disabilities that are specifically mentioned, and there's a few that aren't mentioned. But that are implied or that have been mentioned in comments by IDEA. That's not the important part, though. We'll get to that in a minute, though. But we talked about this in the definition of it. They're specifically mentioned things like ADD and ADHD and epilepsy and Tourette. Bipolar was one they didn't mention, but I've put it in this group. I've kind of separated it into groups that are, one requires trips to the nurse's office for specific accommodations that they need, and though these on this side they may require, medications or that might be something that the health services that the school provides would be able to do is dispense those. But the important part is that only those with limited strength, vitality, and alertness due to chronic health problems and an educational performance that is negatively affected as a result qualify for special education services. Another thing they don't specifically mention, but the evaluation results. So when a student is indicated or when they're first getting started with finding out if they're eligible for special education services through IDEA, they have to go through an evaluation. And that actually plays a large part in this because, as we understand, the other health impairments is a pretty broad spectrum, and so those evaluations are going to be really valuable. And also, different states have different policies about this as well. So some of the OHI classifications seem they might seem redundant, but it's really a lot of these health impairments have a broad variety, a wide range of symptoms or behaviors, and many of them overlap with other IDEA disability classifications. For example, bipolar is actually often under the classification of emotional disturbance, but a student's manifestation of they're bipolar, or it could be different degrees of bipolar, or it in the end their symptoms or behaviors might not meet the requirements to receive special education services under IDEA's definition of an emotional disturbance, and that's a completely different classification. And so, but that doesn't mean that they don't need special education services, and that's why OHI exists. But sometimes you you do need help with things, or these students they'll have things like it's really common you'll see in schools with ADHD or ADD. These students don't necessarily qualify for other health impairment special education services through IDEA, but the Section 504 of the Rehabilitation Act of 1973 is available to these students that don't qualify as OHA. So that's things like, sorry, it protects. This section is actually kind of general. It prohibits discrimination against people with disabilities in programs that receive federal financial assistance. So that is public school. But it protects anyone with a physical or mental impairment that substantially limits a student or has a record of such an impairment. And so even if they don't qualify for special education services through IDEA, and they don't necessarily make an IEP, they still develop a plan for accommodations that will help them get a comparable education to students without their disability. For the other section, the other group that I kind of grouped them up with things that require a little more intensive medical care, like clinical kind of care, and not just, not belittling the disabilities of the other students with things like ADHD and Tourette and bipolar, but some of them under other health impairments require a lot of things, a lot of specific and consistent care. And so a medical home is it's an approach to delivering primary care through a team partnership that ensures healthcare services are provided in a high-quality, cost-effective, and comprehensive manner. And so you can see in this diagram, it's kind of it's a way of saying that it's not just going to the doctor and the doctor deals with it and he tells you what you do when you're gone. Obviously, you have a personal provider who is really important in diagnosing and managing symptoms and things, but through the school and with some special education services through the school, and with the students' parents or their home, you create sort of a network of people who help make sure that the student is getting the health care that they need. And so that's through whole person orientation, is making sure that you have qualified individuals who are available to help in certain things. And again, this is very broad because there are a lot of different disabilities that are impairments that require assistance and services. So there's more information on this. It's been around since 2007 or so, the mid-2000s. But that's an important role in figuring out what services the school should provide and who in the school should provide them. That brings us to the nurse's office. So in addition to adaptations, what other special education services are available to students with OHI? Oh, right, sorry. But it basically falls under two categories. There's medical services, which are, as defined by IDEA, are services provided by a licensed physician to determine a child's medically related disability that results in the child's need for special education and related services. And then there are school health services that are designated to enable a child with a disability to receive FAPE as described in the child's IEP. School nurse services are services that may be provided by either a qualified school nurse or other qualified person. And that was a distinction. Oh, right, no. I think it was in 2007 when IDEA was going through reauthorization. It changed some things around. And one of the things it did is they specified between services that need to be provided by a qualified nurse and services that can be provided by another qualified individual. And some of the things that the nurse, and these are just example of school health services that some of these students might need, like special feedings or clean intermittent catheterization, suctioning, management of tracheostomy, administering and dispensing medications, planning for safety of child in school, and chronic disease management. So again, these needs, they're slightly different than the needs of students with ADD, ADHD, bipolar, Tourette's, and even epilepsy sometimes. But some of the health services required for them are much more intensive. And sometimes they're out of school for weeks at a time, and it's hard for them to stay caught up on their stuff in school. And, and this is why they need a IEP, so they can plan for that, make sure that they can get their education. And so how can we help as teachers? This one is a difficult thing because there are all sorts of disabilities that fall under OHI, and some of these impairments and disabilities require, really different things from the teachers and parents, but there are some things that are always important to do. One of them is working with the students' parents to better understand the students' needs, and to work with them and other teachers or school counselor or anybody else involved that could help and develop a plan, an IEP. And another thing that is always good to do, always important, is learn about the disability of your student in your class. That'll help you to be able to understand better, how you can help that student and what that student should be expected to do or not. And again, working with the parents is another extremely important thing to do to understand that. And the other thing that I feel like is very important and universal for all of these different disabilities and impairments is you need to take responsibility of the role of your student's educator. And so there's no room for deficit thinking when there's things that can't be changed about a student's condition or disability or impairment. There's a way to figure out how to help them. And if there's not, there's other resources, and that's why we have IDEA in the first place.